Have you ever wondered how patients with kidney disease are bringing their creatinine levels back to normal? What if there was a simple solution that could change everything? Imagine this: according to recent data from the National Kidney Foundation, a groundbreaking approach has been transforming lives. Patients struggling with high creatinine levels are seeing remarkable improvements. This isn't just about managing symptoms, it's about restoring kidney function to a level once thought impossible. By watching this video, you'll discover the exact strategies these patients are using to achieve these incredible results. You'll learn how to potentially protect your own kidney health and enhance your overall well-being. Don't miss out on the opportunity to take control of your health. So, stay tuned until the end. By the time this video concludes, you'll gain invaluable insights into safeguarding your kidney health and improving your overall vitality. Number 7. From banning all high-potassium foods for anyone with CKD, to encouraging everyone to enjoy more fruits and vegetables, it's all about prolonging kidney health. Research shows that a plant-based diet delays dialysis. And yes, most plant foods are potassium-rich, like avocados and beans. But here's the twist: avoiding potassium never really helped. It was just a push towards dialysis sooner. Today, we know high serum potassium often links to medications, not diet. Many still think avoiding potassium is crucial, but it's outdated and risky in 2024. Spread the word, share this video to set the record straight, and remember, consult your doctor to keep potassium levels steady below 5.2 millimoles per liter. Number 6. Phosphorus, often overlooked but just as crucial. Unlike potassium, many are still uneasy about it. But here's the scoop: the renal diet has shifted. We used to cap phosphorus at 800 milligrams daily until 2020, not anymore. The KDIGO guidelines evolved, focusing now on monitoring serum levels. This matters because while dietary potassium benefits kidneys, lowering blood pressure, phosphorus can be toxic. We once restricted whole grains, nuts, seeds, even preferred white bread over whole grain. Turns out, plant-based phosphorus isn't easily absorbed, unlike its processed counterparts. Whole grains and nuts offer immense benefits, outweighing their phosphorus content. So, like potassium myths, fearing plant-based phosphorus was off track. But one thing remains constant: understanding and managing phosphorus levels is key for kidney health. Stay tuned for more insights in the final part of this video. Number 5. Hey, let's talk about a big change in how we approach the renal diet. Just 5 or 6 years ago, patients relied on generic leaflets from dialysis clinics to guide their diet. Now, everything's personalized. If you're dealing with CKD stage 3 or higher, you'll be referred to a dietitian who creates a diet just for you. It considers your weight, diabetes status, and other health factors. This personal touch is crucial because following a generic diet could hasten the need for dialysis. So, if you have kidney disease, finding a knowledgeable dietitian who can customize your renal diet is essential. It's all about personalization, and it makes a huge difference. Number 4. Hey folks, let's dive into something really important: protein intake. It's probably the most significant change we've seen so far. Limiting protein intake is now key to telling patients they can delay dialysis for years, even decades. We've shifted from find a dialysis clinic at stage 3 to cut back on steak and dairy to stay out of dialysis for a long time. It's not that simple, of course, but here in Italy, we've advocated low-protein diets for decades. I've been personally promoting this since 2018, sharing stories of patients who've maintained stable kidney function by avoiding high-protein foods like pasta. The big change? Now, we have global guidelines, thanks to DOKI, that recommend a specific protein intake to delay dialysis. It's a game changer, allowing people worldwide, not just those with universal healthcare, to benefit. We've moved from strict potassium limits and dialysis prep to focusing on protein intake, 0.6 grams per kilogram of body weight, to potentially extend kidney function for another 20 years. It's incredible progress, but there are challenges. Many patients, especially those with diabetes, are hesitant to give up meat and dairy completely. So, if you're dealing with kidney disease, following a diet that drastically cuts your protein intake could be crucial unless you're ready for dialysis. But let's talk about the concerns, especially around dietary changes for those with diabetes. Number 3. Diabetes treatment has changed dramatically in recent years, and it's evolving fast. If you have diabetes, staying informed is crucial because now we understand that it can actually go into remission. This wasn't even considered possible not long ago. It's a game changer for patients because managing symptoms is very different from aiming for remission. Before, it was all about medications to lower blood sugar and hoping for the best. Today, there are options like bariatric surgery or intensive weight management programs that can lead to remission. Even medications like spark-SAGA inhibitors are protecting kidneys and improving diabetes outcomes. Now, let's talk about protein, especially important for those with stage 3 or higher kidney disease and diabetes. There used to be a misconception that protein-rich foods were fine for diabetes because they don't spike blood sugar as much. Turns out, that's not quite true. Protein actually complicates glucose management. Red meat, in particular, is linked to higher diabetes risk. Very large study conducted in the U.S. on 195 participants confirmed very recently exactly. So, if you're managing diabetes and kidney disease, steering clear of animal-based proteins is key. They can strain your kidneys and worsen diabetes control. I get it, these findings might stir up some debate. But after dedicating my career to helping CKD patients, I've seen firsthand how crucial these dietary choices can be for managing diabetes too. Number 2. Diabetes management has undergone significant changes recently, and it's important for patients to stay informed. Achieving remission is now a possibility with the right treatments and lifestyle adjustments. Now, before I dive into the 2 biggest changes I've seen in my career, let's talk about what remains constant in CKD treatment. Some things, like sodium intake restrictions, are here to stay. While potassium and phosphorus restrictions have eased, excess sodium still correlates with high blood pressure. Similarly, managing calorie intake and staying active are timeless recommendations for managing obesity, a risk factor for many diseases, including kidney disease. Unfortunately, dialysis hasn't evolved much since its inception in the 1950s, unlike other medical fields. Imagine if dentistry hadn't progressed since then. It's a sobering thought. Hopefully, dialysis will become less invasive in the future. Now, let's address hypertension treatment. Despite their side effects, ACE inhibitors and similar medications remain standard. However, natural remedies and supplements have gained popularity. They're often safer and can be effective alternatives. For instance, supplements like vitamin D and magnesium, and herbs like garlic, have helped patients achieve significant reductions in blood pressure without the side effects of medications. This leads us to the two major changes in kidney disease treatment today. Number 2, the increasing use of natural remedies as primary treatments. These options have proven effective and safer in many cases. And number 1, which I'll discuss next. Number 1. Let's talk about the most exciting breakthrough in natural CKD treatment today, antioxidant therapy. A recent discovery has completely changed how we approach kidney disease. Research now shows that increasing your antioxidant intake can actually improve kidney function significantly. It's incredible how antioxidants can make such a difference in managing kidney disease. A comprehensive review of studies, published in the Cochrane Library, confirms that antioxidants can boost kidney function in adults with chronic kidney disease. So, if you haven't considered antioxidants for your kidney health, you're missing out on a powerful way to improve your GFR and creatinine levels. It's a game changer backed by solid research in the field of health. This is a vitamin to lower creatinine and avoid dialysis, success up to 90%. Today, I want to share 5 proven strategies to lower creatinine levels and avoid dialysis, boasting a success rate of up to 90%, even in the advanced stages of kidney disease. You might be wondering if this is even possible. Surprisingly, many people don't realize that kidney disease claims more lives daily than both breast cancer and prostate cancer combined. It's a massive epidemic that largely goes unnoticed, even among healthcare professionals. Unfortunately, most doctors continue to tell new kidney patients the same disheartening news: there is nothing we can do, you will have to wait for dialysis. But they are wrong. There are effective methods to avoid dialysis, even in advanced stages, and to reverse the decline of kidney function. In this video, I'll show you how to achieve this with practical, actionable steps. Every kidney disease patient should consider these 5 crucial steps if they want to avoid dialysis. Let's get started. Number 5. Prioritize your vitamin intake. Vitamins are often overlooked when it comes to kidney health, but recent research highlights their importance. There's one nutrient, in particular, with remarkable kidney-protecting benefits that few people know about: vitamin U. Ever heard of it? Let me know in the comments. So, what exactly is vitamin U, and how does it protect your kidneys? Vitamin U, also known as S-methylmethionine, is primarily found in raw cabbage. This nutrient boasts incredible healing properties. For instance, a concentrated cabbage juice can be beneficial for treating peptic ulcers. But that's not all. Vitamin U also improves digestion, lowers cholesterol, and boosts immune health. Most importantly, it has significant kidney-protecting abilities. Vitamin U's antioxidant, anti-inflammatory, and antifibrotic properties have been shown to significantly reduce histopathological changes in the kidneys. What does that mean? In simple terms, this vitamin has a powerful antioxidant effect that can mitigate the damage caused by oxidative stress on the kidneys. Studies found that, under intense oxidative stress, the kidneys of test subjects given vitamin U exhibited fewer signs of damage. This is crucial because diseases like diabetes and high blood pressure primarily harm the kidneys through oxidative stress. Now, how can you get more of this vitamin? Primarily through foods. The best sources of vitamin U include vegetables such as carrots, celery, parsley, green onions, asparagus, beetroot, and especially cabbage. These foods are excellent for a renal diet and offer numerous health benefits. Additionally, vitamin U can be taken as a supplement, either labeled as vitamin U or S-methylmethionine, they're the same thing. A common dosage used in studies is 500 mg per day for 8 weeks. And remember, vitamin U isn't the only vitamin with antioxidant properties that can benefit your kidneys. So, what antioxidants should all kidney patients use? There are many essential vitamins for kidney health, including B vitamins, vitamin D, and vitamin C. However, today, the vitamins showing the most promise for improving kidney function are those with antioxidant properties. Increased antioxidant intake has been proven to enhance kidney function, making antioxidants one of the few treatments that can achieve this. Vitamin U is a great example of this. But when it comes to antioxidant vitamins, perhaps the most widely used is vitamin C. Studies show that consuming more vitamin C can boost your blood antioxidant levels by up to 30%, which is a highly effective way to protect the kidneys. Antioxidants like vitamin C, at sufficient concentrations, can neutralize free radicals, which can otherwise damage kidney cells. This oxidative stress is one of the leading causes of kidney damage. In addition to protecting the kidneys, vitamin C is crucial for iron absorption and fighting anemia. It also plays a vital role in wound healing, bone and tooth formation, and heart health. Studies have also linked vitamin C to lower blood pressure. For those with kidney disease, the recommended dose of vitamin C is 60 to 100 mg per day. Another powerful antioxidant is vitamin E. It is so effective against oxidative damage that it was used in a study with 59 diabetic kidney disease patients in stage 3 CKD to reverse disease progression. It also helps with proteinuria, inflammation markers, and heart health. While vitamin E is not usually recommended for CKD patients due to its fat-soluble nature, meaning it can accumulate in the body if taken in large doses, it is generally safe, and toxicity is rare. For now, it's better to get vitamin E from foods. Sunflower seeds, for example, provide up to 66% of your daily value for vitamin E in just 1 ounce. This can offer significant kidney protecting benefits without any risk. If you want to learn more about the best antioxidants for your kidneys, comment antioxidants. I'll be making a video about it in the next few days. But don't go away yet, there are some tips to significantly slow down kidney disease and help your kidneys that I would recommend to every CKD patient. Number 3. First of all, sleep more. Many people don't realize this, but inadequate sleep increases your risk of kidney damage. Getting 7 hours or more of sleep per night is linked to better kidney health. Plus, sufficient sleep will give you more energy during the day. Also, consider drinking water at regular intervals. Being dehydrated negatively affects the kidneys in several ways, as regular water intake is essential to flush out excess sodium and water through urine. This is even more critical for those with diabetes. Drinking enough water can help keep your blood sugar levels within healthy limits because excess sugar is also expelled through the urine. So, unless you have a water allowance, drink more water regularly. Make exercising a priority. Regular exercise is the only thing in the world that can simultaneously treat drug-resistant high blood pressure, lower cholesterol, and blood sugar levels. If anyone could create a drug that offered the same benefits as regular exercise in a pill, they would become instant multi-billionaires. Until then, regular exercise is the closest thing to a panacea. Even walking at a brisk pace every day and taking the stairs instead of the elevator counts as exercise. Ensure you are not actively damaging your kidney health. I always highlight vitamins, remedies, and good habits that can protect your kidneys. However, some bad habits can cause far more damage than these remedies can fix. For example, painkillers and NSAIDs are extremely harmful to the kidneys, even at low doses, as they reduce blood flow to the kidneys, hindering any improvement. Smoking is also incredibly damaging. Smokers often have more proteinuria, indicating direct damage to the glomeruli inside the kidneys. The same goes for excessive alcohol intake and consuming meat and junk foods. Avoid these harmful habits. More importantly, make sure your diet is well planned and stick to it every day. A renal diet is essential for every kidney disease patient aiming to improve their kidney function. There's no doubt about it, avoid foods rich in protein and focus on plant-based foods. Be rigorous with your diet. If you want to learn more about how to eat to protect your kidneys, please watch my recent video on the topic. One last tip: regularly measure your blood pressure and blood sugar levels and write them down. On the journey to better kidney health, always find ways to naturally lower your blood pressure and blood sugar levels if you have diabetes. Focus on making progress. Now, you might wonder, how can you have a 90% success rate in reversing kidney disease? While not every kidney disease patient will be able to avoid renal failure, combining the tips I've shared with the other steps in today's video will significantly increase your chances of success. This is because you are now prioritizing your health, giving your body the importance it deserves, which very few people do. If you are getting informed, taking steps toward better kidney health, eating healthily, and exercising, then congratulations. You are doing your best to fight for the most important thing in life, health. And that really is all that matters. But if you think these tips are not enough, you still haven't seen the most important steps to reverse kidney disease. One is probably the most significant advancement in kidney disease treatments in recent years. Number 2. Before we dive in, here's a question many of you are asking: can you still improve if you're on dialysis? Unfortunately, it's uncommon to stop dialysis without a transplant. While this isn't typically expected, there have been more cases of dialysis patients recovering kidney function spontaneously than most realize. This doesn't mean you should decline dialysis or a transplant if offered. However, if you've recently started dialysis, it's still wise to monitor your creatinine levels with every blood test. Why, you may wonder. As mentioned, regaining kidney function during dialysis is rare for people with CKD. It's more common in acute kidney injury cases, but that's a different situation. Studies show that improvement among CKD patients on dialysis is generally limited, though some do experience spontaneous improvement. The challenge is many such patients remain on dialysis because doctors often don't closely monitor creatinine levels. Determining if dialysis is still necessary isn't a priority. It may sound alarming, but some patients continue dialysis unnecessarily. What should you do? Keep checking your creatinine levels even while on dialysis. If you see levels below 3, request another test and ask for your GFR, glomerular filtration rate, to be calculated. Protect remaining kidney function by avoiding medications harmful to kidneys and contrast dyes during scans. Manage blood pressure and blood sugar levels well. Don't overly stress about protein intake, it doesn't harm kidneys during dialysis. Recovery is rare but possible. No one wants unnecessary dialysis 3 times a week. Alright everyone, it's time for our top tip today. Did you know there's another organ in your body besides the kidneys that can effectively remove ureic toxins? These toxins, which are harmful wastes and acids, can either be filtered out by your kidneys or expelled through your gut. Allowing your gut to handle this detoxification process instead of solely relying on your kidneys can be a powerful strategy. So, how do we make this happen? Probiotics, according to scientific research, can enhance your gut's ability to eliminate ureic toxins. A healthy gut can consistently assist in removing substances that your kidneys may struggle with. Ureic toxins can be especially taxing on your kidneys and overall health, making gut detoxification a beneficial approach. One of the most effective ways to support this process is by using a prebiotic supplement. Prebiotics offer a range of benefits. First, they nourish the beneficial bacteria in your gut, which thrive on fiber rather than carbohydrates or proteins. Studies indicate that most people do not consume enough fiber daily, which is crucial for maintaining a thriving gut microbiome. Secondly, maintaining gut health is critical for individuals with kidney disease, as it can help address issues like constipation or irregular bowel movements, which can worsen kidney damage. Remarkably, a prebiotic fiber supplement can alleviate both these concerns. Thirdly, specific prebiotic supplements play a significant role in achieving our goal of reversing kidney disease in up to 90% of cases. One highly recommended prebiotic is acacia fiber, derived naturally from the gum of the acacia tree. Besides supporting gut health, acacia fiber absorbs ureic toxins in the intestines. When taken in therapeutic doses of about 4 to 5 tablespoons daily, acacia fiber functions similarly to intestinal dialysis, safeguarding kidney health and reducing ureic symptoms. Medical studies have documented its success in managing end-stage renal disease, sometimes even eliminating the need for dialysis for up to 8 years. That wraps up today's top tip. Thank you for watching, and may you all stay blessed. Bye for now.